Hi, I'm Dr. Jenny Brook from Spinal Corrective Center in Amherst, New Hampshire, and I have Alicia with us. She's a patient of ours who also happens to be a professional model. And we've been really working hard on Alicia's spine, helping her just be super healthy, which is great with all the photo shoots she does. And we were talking the other day about how she tends to have congestion in her sinuses and in her ears. So one of the things I told her that we could do that would probably help was a sinus adjustment. And people are always surprised that you can actually adjust the sinuses. And frankly, it's a fairly simple thing to do, but it can be super impactful. So basically what we're going to do is I'm going to use the pad of my thumb. I'm going to stabilize it with my other hand, and we're going to put pressure on the maxillary sinuses that are below the eye, and then in the center of the frontal sinus. And if you think about, think like a ketchup bottle where like the ketchup gets stuck on the inside of the bottle, and if you shake it, you can get the ketchup to come out. I know that seems kind of weird, but that's basically what this is doing. We're going to cavitate or create some type of force into the sinus. That's really not even that forceful, but it helps shake up the sinus, and it helps the fluid and the mucus that's been stuck in there drain out. And people will tell me that even within a few minutes or a day, they can notice a pretty dramatic difference. So sinus adjusting is something I do fairly regularly for our patients, especially during cold and flu season. So I'm going to have Alicia lie on her back. And I would typically do this after a full normal adjustment. And our table here has a drop mechanism. So I lift up a handle, and you'll actually see, I'll just show you the table first. It's going to drop just like that. A little more tension. Show you again. It's going to drop like that. So this time, I'm going to use my thumb. Close your eyes for me. We always do it with the eyes closed. I don't want to accidentally get a thumb in her eye, right? So I'm going to put a gentle pressure right below her eye. Put my hand above it, and you'll feel a push. Good. Didn't hurt, did it?
No.
Really? Did it hurt?
No, it felt great.
It felt good. Okay,
Yeah.
good. She said it felt good. This hand, we're going to go to the other sinus. You'll feel pressure. Close your eyes. Good. And then one more right in the center. Good. So if they know the table is going to move, they don't have to be worried about that, because that noise can be kind of interesting. We're going to go ahead and sit up. You can face forward. And really, I just basically give them a tissue at that point to take in the car, because it's super common that the sinuses are going to drain pretty shortly. So hope it helps. Be well, everybody.